Hello, and welcome to Contra Costa. Thank you for visiting us on our website. My name is Stephen Harper, and I'm an instructional designer for the residency program. We are proud of the extensive and diverse set of electives offered in our program, with 21 electives currently provided and more in the making. Our available electives reflect the robustness of the training we offer and the advantages of being an unopposed residency that is embedded in an integrated healthcare system that serves all of Contra Costa County. We can create an elective in any department or program of this integrated system where there is an interested faculty member eager to supervise it. For instance, since we have no opposing residents working in labor and delivery, nor in our ICU, we have OB and ICU electives. We can also arrange electives in various portions of our integrated healthcare system. For example, we also provide healthcare in our county's detention system, so we have elective opportunities to care for the vulnerable populations in the jails. Many of our graduates are faculty or leaders in departments or programs and are positioned well to support our electives. For instance, one of our graduates is a leader in our Healthcare for the Homeless program, and thus residents can do an elective with that program. Another graduate leads our Suboxone groups, so we have a substance use disorder and medication-assisted therapy elective. Our electives are divided into three broad categories: ambulatory, meaning primarily outpatient; acute care, meaning primarily inpatient; and away electives that can be done at an outside institution, including abroad. The following is a partial list of our ambulatory electives, but more are in development. For instance, in the infectious disease elective, the resident will attend our positive health clinic, devoted to the care of patients with HIV, and our tuberculosis clinic, and shadow a public health nurse doing community outreach to patients with TB. The resident will have the option of attending an STI clinic. In the lactation elective, the resident will spend additional time in our inpatient nursery, focusing on supporting mothers in breastfeeding their infant. The resident will also work in a newborn clinic. The faculty member who supervises this elective, a graduate of our program, worked with Médecins Sans Frontières and teaches about supporting lactation and infant feeding in resource-poor settings. The following is a list of our current acute care electives. For instance, the hospitalist elective is an R3 elective for residents who are interested in becoming a hospitalist. The OBGYN elective will allow the resident to gain more C-section experience and improve surgical skills, as well as diagnose and manage acute gynecologic complaints. Our residents have the option to spend up to 10 weeks of their electives at outside institutions. Here are some examples of electives that residents have recently done within the U.S., including learning about medication-assisted treatment at Swedish in Seattle, health policy at the Robert Graham Center in Washington, D.C., and abortion training at Desert Star Family Planning in Phoenix. Away electives can also consist of global health work. Our residency has long-term relationships with several sites, so residents over multiple years have rotated, for instance, in Chiapas, Mexico with Partners in Health, Santa Clotilda, Peru at a health center in the Peruvian Amazon, and Nahoma, Malawi at a training site for their family medicine program. You can learn more about our Global Health Fellowship on our website at the URL below. Residents have also arranged electives in many other countries, as listed here, such as India, China, Kenya, and more. We also allow residents in consultation with a faculty member to build their own electives within our system. The prior lists of some of our electives just scratch the surface of the clinical activities available within our system. For instance, if a resident has a special interest in dermatology, and since our system has a dermatology clinic every day of the week, a resident could easily build their own dermatology elective. Our program has embraced the recent ACGME directive that family medicine residents should have ample elective time and opportunities to shape their clinical training to match their future career plans. When you start here as a resident, you will work with your advisor and the core faculty to develop your individualized learning plan. If our current elective offerings do not match those plans, then together we can help you build your own elective to achieve those goals. Thank you for watching and sharing your time with us. We hope to see you soon.